Hello, welcome to the distal upper extremity, the wrist. This is one part of the distal upper extremity, the wrist. The next part will be the hand and the digits. So today we're just going to do the wrist. And so the shoulder, elbow, and forearm and wrist move and position the hand. When we start talking about the hand, we'll talk about grasp and manipulations of the hand to complete the task. So the wrist is part of this system to help position your hand, and we need that wrist to help us to do that. So the wrist positions the hand so that the long finger flexors and extensors can grasp and release objects. The wrist extensors allow us to grasp objects, so when we're in wrist extension we get a better grasp, and the wrist flexors allow us to release objects better and quicker. So when we talk about the wrist, we have ulnar deviation, and ulnar deviation is also known as wrist adduction, and it powers functions such as hammering and throwing. So when we take our wrist and we ulnar deviate, we're bringing it towards the ulnar side. If I was doing it this way, it's kind of like I'm hammering, hammer, or throw. When we do radial deviation, we're bringing it towards the thumb side, and we'd be bringing the brush back. This is not a great picture, but if I was to brush whatever hair I have, I'd bring it back, bringing it back. Okay, so the wrist has 8 carpal bones, and they're joined in a semicircular arrangement with 2 other bones, and that's framed by the radius and the ulna. So here's your radius and your ulnar. Radius here and the ulnar with the ulnar disc in between. You have your first row of carpal bones and then your second row of carpal bones. There's first 4 in each row. So at the center of the wrist you have the capitate, and then just distal to that would be the third metacarpal. These are good landmarks for you. And the 10 bones of the wrist, including the 8 carpal bones, the radius, and the ulnar, make up 10. They articulate with ligaments that form these arches. And we have an arch, 2 arches anteriorly. You have the proximal and the transverse arch, like you see straight above here. The proximal is closer to the proximal portion, and the distal is closer to the distal portion of the row of the hand. And that helps to form an arch that way, so the hand's like arched this way. And then when we look at the other view here to the left, you also have what's called the longitudinal arch. So you have a proximal arch, a distal transverse arch, both of them are transverse, and then a longitudinal arch on the convex surface. The wrist has this flexor retinaculum. And that flexor retinaculum is also known as the carpal ligament. The flexor retinaculum wraps around the wrist and helps to form the carpal tunnel below. And it goes from the hook of the hamate on the ulnar side and the pisiform, and it goes over and wraps over to the radial side to the scaphoid and trapezium. And that helps to form that transverse ligament or transverse carpal ligament, otherwise known as the flexor retinaculum. And the combination of having this wrap over forms a tunnel below, which we call the carpal tunnel. Now, technically speaking, in orthopedics, they actually name each little tiny tunnel for each little tendon and nerve and so on and so forth. But generally speaking, the big tunnel is between this transverse carpal ligament below. And the carpal tunnel is known as is well known because people get carpal tunnel syndrome. So we have a carpal tunnel, but carpal tunnel syndrome is when you have compression over long periods of time in that carpal tunnel area. And I see syndrome is spelt wrong. Okay, a little typo there. But you have the median nerve is a very large nerve passing through there. And the median nerve supplies the thumb, the ring finger, and the index finger, and a portion of the 4th digit. And so it supplies sensory and motor to those digits as well. So the median nerve is sensory and motor for the middle finger, the index and the thumb for sure. And there's a portion of the fourth digit that has some sensory on it. And carpal tunnel syndrome is more common in females than in males. It's very common with thyroid disease and also pregnancy. Things that run over the retinaculum are carpal ligaments. So we have superficial structures and then deep structures. The superficial structures above the flexor retinaculum or carpal ligament are obviously the tendon of the palmaris longus. If you remember, that tendon comes into that palmar aponeurosis. Remember the model we use, you just pull that thing off. That's the palmar aponeurosis. And so this tendon of the palmaris longus is above the flexor retinaculum. And also you have arteries and nerves. So you have the ulnar artery and the ulnar nerve. Then you have cutaneous nerves of the ulnar branch and a cutaneous nerve of the radial branch. And again, these are structures that are above the flexor retinaculum. And then there are structures that lie deep to the flexor retinaculum or carpal ligament. And that would be the median nerve, a big nerve. And then you have the tendons of three muscles here. The flexor digitorum superficialis and the flexor digitorum, that's a typo, profundus. The tendon of the flexor pollicus longus is also passing through there. So those are deep to the flexor retinaculum. The wrist is classified as a condyloid joint allowing movements around two axes. So you have two basic axes. You have flexion extension occurring on the sagittal plane, and then you have radial and ulnar deviation occurring on the frontal plane. Now when you look at flexion and extension of the wrist, it's not just at the distal radius and the first row, it's actually two areas. You have on the left, all the way to the left of this, all the way to the left, I'm going the other way, all the way to the left, here we go, all the way to the left of this, you see the radius and the lunate and the scaphoid, and also the articulate disc of the ulnar. So the radius and ulnar are going to articulate with the scaphoid and the lunate and the triquetrum. That's the first row, so that's the first joint. And then there's a distal joint between the mid-carpals, that would be between the first row and the second row. So when you flex and extend your wrist, there's actually a certain degree of movement at each area. And then circumduction describes the combination of both flexion, extension, abduction, and adduction of the wrist combined. Muscles are named for their function at the wrist, and they contain the word carpi if it's at the wrist. And they originate on or near the distal end of the humeral epicondyle. So you have a lateral epicondyle and a medial epicondyle. The extensors generally come from the lateral epicondyle, and the flexors generally come from the medial epicondyle. And their function depends upon the muscle's relationship to the axis of motion, not on its name. So the muscles that pass over the anterior side of the axis are starting from the medial epicondyle, and they are the flexors. And if you look at the left side of the screen, we have this FCR term that's abbreviating FlexorCarpi radialis, FCU, FlexorCarpi ulnaris, PL, palmaris longus, FDS, Flexor digitorum superficialis, FDP, Flexor digitorum profundus. Now, if you look at the image to the right, you'll see that it says Flexor pollicus longus as well. We're not including that. We're using Sieg and Adams' list for the flexors of the wrist. So according to Sieg and Adams, there are 5 flexors of the wrist, not 6. And so this is the image I was able to put up here. I didn't have an image from Sieg and Adams for you, so I put this image up. It's a nice color image. It identifies all the different muscles of the flexors of the wrist. And then the muscles that pass over the posterior side of the wrist are coming from the lateral epicondyle, and they include the extensors of the wrist. Now, We extend the wrist at the carpals. Yes, we have words that have the carpal word in there. And then we have some digit words. These digit muscles, yes, they do extend the digits, but they also help and assist extension of the wrist. So as you look at this, you see the ones with the carpal word in there: FlexorCarpi radialis longus, FlexorCarpi radialis brevis, FlexorCarpi ulnaris. And then you have the extensor digitorum going all the way to the digits. And then you have the extensor indicus going to your second digit, and the extensor digiti minimi going to the pinky. So they all assist and they all work as synergists in extension of the wrist. The flexors of the wrist, that the FlexorCarpi radialis also does radial deviation. So the name FlexorCarpi radialis tells you it's flexing the wrist on the radial side more, and it also deviates the wrist to the radial side. The FlexorCarpi ulnaris, it flexes the wrist and at the carpals on the ulnar side, and therefore it can also do ulnar deviation. The palmaris longus just flexes the wrist. It really, what it does, it wrinkles the palm and starts and initiates or assists in flexion of the wrist. Okay, so here's an image of the FlexorCarpi radialis, and you see it coming all the way down on the flexor side from the medial epicondyle to the radial side of the carpals. And here's an image of the FlexorCarpi ulnaris, and it does both flexion and ulnar deviation of the wrist. Now, the FlexorCarpi radialis also does radial deviation, even though it wasn't written there. I just noticed it wasn't written there. The palmaris longus simply does flexion of the wrist. The extensors of the wrist include the FlexorCarpi radialis longus, which can also radial deviate, FlexorCarpi radialis brevis, that just does pure wrist extension, and the FlexorCarpi ulnaris, which can extend the wrist and ulnar deviate. FlexorCarpi radialis longus can extend and radially deviate the wrist. Here's an image of it coming down. And then the FlexorCarpi radialis brevis does pure extension, and the FlexorCarpi ulnaris does extension and ulnar deviation. So now you can pair some muscles together to do those deviations. And when they pair together, like a flexor and an extensor, that both do radial deviation or ulnar deviation, they're canceling out one effect to produce another. So although they may be a flexor and an extensor, they're going to work together to do either ulnar deviation or radial deviation. So here you see an example of this. We have the FlexorCarpi ulnaris and the FlexorCarpi ulnaris. And they're both coming to the ulnar side. Even though they're extensors versus flexors, they can cancel out the flexion and extension, and both can actually act on pure ulnar deviation. And the same thing with the FlexorCarpi radialis and the FlexorCarpi radialis longus. And so now you have a radial side. They're all both going to the radial side, and they will cancel out the flexion and the extension and do pure radial deviation.